Hey, hey, lovely listeners. Happy July. If you're in the Northern Hemisphere, I hope summer is everything you want and more. It certainly is for me. I love this time of year. We just got back from a 40th birthday celebration for a dear friend in Bermuda. And if you've never been, I highly recommend it. The island is stunning. Their beaches are perfection and there is lots to do and see, even though it's just a tiny 21 square miles. And this is coming from someone who is from a Caribbean island with perfect beaches, so I feel like that's saying a lot. Also, fun fact, if you're not a Bermuda resident, you can't rent a gas-powered car, only these super tiny electric cars. We did that for one day, and Hayden kept referring to it as the can of corn and the rickshaw because of how tiny and slightly rickety it was. Keep in mind, though, Bermuda is so remote, which means it is breathtakingly expensive. Antigua, where I'm from originally, is incredibly expensive, but this was even worse. I was actually really surprised, even though these things don't usually shock me. Entrees in restaurants, for instance, were anywhere between like 55 and 90 US, and the tiny rental car that I just mentioned cost us nearly $200 for the day. So be prepared if you do decide to make a trip to Bermuda. On a completely separate note, I finally launched my brand new membership, the Fix Your Period Collective. And as I've talked about, it's a first of its kind membership platform in that it will give you personalized information about your menstrual cycle displayed in a dashboard format once you take my detailed period quiz. You'll also get a period score based on everything you share in the quiz, and you can see not only your score, but all of the explanations for all of your menstrual cycle related symptoms inside the dashboard. In addition to that, inside the membership, you'll find the Period Pillars, which is my step-by-step signature program that I have put a lot of effort into. We have dozens of condition-specific period protocols, including things like how to use castor oil packs, heavy periods, painful periods, a whole bunch of different ones. We have a recipe room, a community, a supplement shop, all of my blog posts and podcasts organized by category, and a product shop with every period product imaginable. So you can take advantage of everything this platform has to offer. Just go to fixyourperiod.com and take the quiz to get your period score and everything that you will find inside the membership. Alrighty, on to this episode. I am joined by the incredible Jocelyn Wallace, a pelvic health physical therapist who specializes in helping women return to the activities they love following gynecological surgeries like hysterectomy, myomectomy, and excision surgery. Jocelyn brings a wealth of professional knowledge and personal experience, having navigated her own recovery journey as an athlete. After undergoing multiple surgeries, including a total hysterectomy and the removal of over 70 fibroids, she's dedicated her career to filling the support gap for women post-surgery. We dive deep into the reasons behind why someone might need a hysterectomy, discussing conditions such as fibroids, endometriosis, and chronic pelvic pain. Jocelyn provides invaluable insights into preparing for surgery, both physically and emotionally, and shares her top tips for early recovery, including pain management and mobility. We also explore the importance of pelvic floor health, the challenges of resuming physical activity, and the potential hormonal changes post-hysterectomy. This episode is packed with practical advice and personal stories, making it a must listen for anyone who is potentially facing a hysterectomy or some other gynecological surgery and wanting to understand how best to recover from it. I hope you enjoy this episode. Hi, Jocelyn. Thank you so much for being here with me.
Yeah, thank you so much for having me. It's a huge
Ah,
honor.
oh, thank you. Well, right back at you. I'm thrilled to be having this conversation with you because it is much needed. When I think about hysterectomy, I was actually thinking about my mom because, she was potentially going to have one because of a prolapse a couple of years ago, and I remember thinking that she wasn't really getting much information in terms of the preparation for it or how to recover from it. So that's
Mhm.
why I'm really excited to have this conversation with you because I feel like this is really vital information that women need to know. And I feel like they're in the dark a lot of the time when it comes to these surgeries.
Oh, yeah, and it's the second most common surgery performed on women in the United States, at least, and nothing, no support, nothing.
I mean, we're using we're losing a whole organ. I don't understand. Yeah, it is
Multiple
so
organs in
crazy.
many cases.
Yes, very true. That's a great point. I know. So maybe we can start there because obviously I mentioned my mom's experience, but there are lots of other
Mhm.
conditions that would lead you to getting a hysterectomy. Maybe you can discuss some of the common medical conditions and symptoms that might lead someone to consider getting a hysterectomy. Obviously, we know this is very subjective, but I would love to share with the audience, what that might mean.
Yeah, absolutely. The most common reason for hysterectomies are fibroids and other menstrual health disorders, especially for benign reasons. So fibroids, endometriosis, adenomyosis, it can be performed as for prolapse symptoms, a variety of different cancer issues, and some people have it done preventatively when they find that they have one of the genes that puts them at risk for female related cancers.
Okay, yeah,
So
that's super helpful. And so, in terms of the decision factors, when is a hysterectomy considered a good idea compared to addressing the underlying issues through less invasive treatments?
oh gosh, I don't think there's really any situation where it's either or. Even if someone like myself, I ended up choosing to have a hysterectomy. I've had over 60 fibroids removed, 2 open myomectomies, a C-section. Finally decided, made the decision to have a total hysterectomy, but I'm still also working on addressing the underlying factor me at risk for such a severe situation. So I
Yeah.
think both always need to happen. But if the situation has become debilitating, it's affecting your quality of life, it's removing the person's ability to engage in healthy behaviors, and there's just no breaking out of that cycle, I think surgery could be a valid choice, of course, in many, many different situations. But I'm absolutely a believer that you should still be working on addressing the underlying factors that got you in that place in the first place.
Yeah, I cannot agree with you more. I want to talk more about your story in a moment, but
Mhm.
I feel as though oftentimes it's the first line of defense, so to speak. I often hear that women and especially young women, it's quite shocking how often they're told, well, you can just have a hysterectomy type of thing.
Yeah, without being helped in trying anything else. So I think the ideal team for a woman going through these kinds of things is a physical therapist, a nutritionist, or some form of health coach, some kind of trainer to help them exercise around their symptoms and mental health support. And most people never get to try any of those things before making a choice to have a life-changing surgery that permanently alters your anatomy.
Yeah. Okay. We're going to get into that part too. So, can we come back to your story? I mean, you just gave me a glimpse there, but I would love to hear just how you got into this work and I know you also have had a hysterectomy, so can you just talk about your own experience in history?
Absolutely. The long and short of it is I had fibroids my entire adult life. So heavy periods in my late teens that just start spiraling out of control. I was eventually diagnosed with fibroids. I had my first open myomectomy when I was 26. That's the one that I had without doing any research, without addressing any lifestyle factors, without even looking into how to choose a good surgeon. So the surgeon didn't even remove every fibroid because he didn't want to give me a quote unquote Swiss cheese uterus. So my symptoms, of course, came back. My fibroids, of course, grew back. And then I went through the lifestyle modification side of things and was controlling my symptoms very well for a very long time. But he left fibroids. So they did eventually grow back. And I went through an infertility journey and ended up having a second myomectomy because the fibroids had regrown, even though my symptoms never got as severe as they were previously because I was managing pretty well. So I had 47 fibroids removed in my second open myomectomy. This time around, I went to an expert surgeon who was able to do a really thorough surgery. So then I was able to conceive a few months after on our first try. So again, addressing those underlying causes, I believe is a big part of why that journey was so successful for me. And I think is a big reason why I was able to conceive even after so many, like such severe surgery. So that happened. I had a C-section almost a year to the day after my open myomectomy. And then in pregnancy, my fibroids came back quite badly. And I made the decision to have a hysterectomy a little bit less than 2 years postpartum.
My goodness. Okay, this is a harrowing journey. I can't believe what you've been through. No, seriously. It's really I feel important to be talking about this because I think oftentimes, these decisions They certainly don't come lightly. And to hear the entire history and the background, I mean, this sounds like it was a decades long journey for you.
Oh yeah, absolutely. I'm 34 and a half now.
Yeah.
So it's been my entire adult life. I don't know anything different.
Right. Yeah, of course. And so can you talk about some of the symptoms that you were experiencing while, in the lead up to understanding that you had fibroids and you had this many fibroids?
My first symptom was heavy bleeding. So really, really heavy bleeding that I didn't even realize was abnormal. So clotting, periods
From
that seem to
teenage
never
years?
end. Mhm.
From teenage time. Okay.
Yes,
All
from
right.
teenage years.
Yeah.
And this is a thing every woman in my family has had a hysterectomy. It's in our lineage. So it started, I thought it was normal because everyone else in my family had experienced it. And I just lived with it for years until it got so out of control that I was severely anemic, wasn't breathing well, had no color in my skin, like it's just terrible. And I was in graduate school at the time, so things were just not going well. So that was my primary symptom for my first surgery. After for my second surgery, I was having more bulk symptoms, which I think a lot of people don't realize can be a cue that fibroids are growing back, even if you're not having heavy bleeding. It can also be a clue that you have fibroids in the first place because not everybody bleeds really heavily. So I was having frequent urination, leg pain, symptoms of pelvic congestion, gaining weight for no reason, my stomach getting really large, workouts getting harder, things like that for my second surgery. And that's when I was doing a lot of lifestyle stuff. So my bleeding was really well controlled. But as the fibroids grew and multiplied, I started to get a lot of those bulk symptoms.
Hmm. Okay. Wow. It's unbelievable to think about how long you dealt with that as well. And I imagine, the decision to get to the point where you did have a hysterectomy was certainly not a light decision. And, thinking about how someone gets to that point. Maybe we can talk through that a little bit, like I suppose, a
Yeah.
pre-surgery decision checklist. So maybe you can talk about the steps that someone should take to prepare for a hysterectomy. I imagine there's multiple things like pre-surgical consultations, medical tests, instructions around like diet, physical activity, things like that.
Yes, absolutely. There's so much that can be done. I think the first thing is to explore all of your options. So I consulted with interventional radiologists to learn about uterine fibroid embolization. I consulted with 5 different surgeons over my journey to figure out my options, some of whom recommended hysterectomy. And this is before my second open myomectomy, some of whom recommended hysterectomy. There's options like Sonata, which is like an ultrasound guided treatment. Um, some of them recommended myomectomy. So just making sure that you explore everything so you understand all of your options. And that process alone can take months and a lot of research. There's also some medications on the market. So making sure you understand all of that. And I'm a huge advocate for leaning towards the doctors that actually tell you all of your options because a lot of surgeons will just sell the surgery that they're the most comfortable doing. So it's a huge green flag when you get in front of someone that even tells you about the things that they don't offer, they don't do, and is truly honest with all of the options out there. The reason that I chose to have a hysterectomy is because my situation is so severe and I had already had 3 surgeries. So I was balancing the pros and cons of continuing to have repeat surgeries, especially because I'm young. So fibroids are very likely to continue to come back for somebody like me versus if someone is older and it's their first surgery, they might feel more comfortable considering something like a myomectomy.
Okay. That's good to know. And so in terms of the different surgical procedures, I feel like we don't need to go too in depth into all of this, but because I know that there are multiple options, but you said
Mhm.
knowing what to do or which procedure to have. Can you just talk a little bit about each one so that people understand like what the options might be?
Yeah, so the 2 primary surgical options for fibroids specifically are hysterectomy and myomectomy. And then each one can be done with an open abdominal incision, which is just like a bikini line incision, a lot like a C-section scar, or laparoscopically, so the little portholes throughout the abdomen. So they're both typically done in one of those ways. The laparoscopic version is typically touted as minimally invasive I like to say that this is a marketing term. It can be easier from an incision healing standpoint, but you're still having a major organ either operated on or removed. So the recovery can still be challenging, even though it's smaller incisions. But I think there's a lot to consider as far as like how long do you want to wait and see how bad your symptoms get before choosing to have a surgery while you still have a higher likelihood of having it done laparoscopically. So that was another consideration in my case is I didn't want to have another big incision, right? Because my first 3 surgeries were big incisions at the bikini line. So I chose to have a hysterectomy while I was still able to get it done laparoscopically without having to have a 4th large incision. So I think that's definitely something to explore as you're consulting with your options. And then a lot of the other options out there, so like uterine fibroid embolization, Sonata, those are all non-surgical procedures that can help to shrink fibroids. The reason I didn't choose those is because they only have a 60-ish% effectiveness rate. And again, my situation is so severe that I would have had a high likelihood to continue to have repeat procedures.
Okay, right. And that totally makes sense. Thank you for laying all of that out there. Because again, I just feel like it must be so overwhelming, especially as a layperson, to be navigating a situation like this. And so I feel like that breakdown is super helpful. Coming back to that pre-surgery checklist or understanding of what you might want to be doing, what about dietary recommendations, physical activity, things like that?
Yeah, so dietary recommendations, the first thing that I recommend somebody does is make sure that they're meeting basic protein guidelines for around surgery. There's a protocols called enhanced recovery after surgery protocols that recommend 1.5 grams of protein per kilogram of body weight, not per pound of body weight. So making sure that people abide by those recommendations and then having a healthy, nutritious diet. And if someone has the means and the surgery is not an emergency, then exploring the deeper reasons why they're in this boat and starting to work on those things before even having the surgery. So do they have, I'm not an expert in nutrition the way that you are, but do they have other things that they could work on to improve their hormonal health, to improve the quality of their sleep, their stress regulation? All of that sort of stuff is not only going to make surgery an easier experience, but it's going to make life after surgery an easier experience. There's something that you can do to improve the reasons why you're ending up in this boat in the first place. From a
Yes,
physical
love that.
from a physical activity perspective, resistance training is number one, my biggest recommendation. So building strength in your body is going to support your pelvic floor, your abdomen, all of the places that are impacted not just by surgery, but also by the conditions that lead to surgery. So things like fibroids, the bloating and pressure that people experience when they have endometriosis, that wears on your pelvic floor over time. That wears on your abdominal wall, your spine sometimes over time. And working on strengthening and getting better mobility in those structures can help make your early surgery recovery a lot more comfortable, but then also life after surgery a lot more comfortable.
So good. It makes me think about the mental and emotional preparation as well, because you said endometriosis and how it's physically taxing. And I know from talking to so many people over the years that the mental and emotional toll of these chronic conditions is really big too. Do you have any tips or thoughts on how someone can prepare mentally and emotionally for surgery, or are there any resources that you recommend?
Yeah, I think mental health support is an absolute must, especially like for people with endometriosis. There's such an intermingling of all the pain that they've been through and all of the emotional turmoil, then worsening the chronic pain. And it's a really dense bucket of factors that can contribute to the things that they go through. So I think mental health support is absolutely essential. It's hard to find people that have a lot of experience working with this population, but sometimes you can find it by looking for mental health therapists and people that work with the infertility population specifically. So they will have often encountered a lot of women and worked with a lot of women that had complex menstrual health disorders and um, problems like endometriosis, which we know now is not a purely menstrual health disorder or reproductive health disorder, but finding a mental health supporter that has some experience with these issues can be really, really, really valuable for people, especially for people that are in the boat where they're choosing to have a hysterectomy when they have not been able to have children like they wanted, they can like those we need mental health support in a situation like that.
Oh, yes, I couldn't agree more. I know it's so nuanced and so layered. And like we were saying earlier, the fact that there's very scarce resources for women who are navigating this process is just really, really sad to me because there are just so many, not only physical repercussions, but mental and emotional ones too.
Yeah,
Yeah.
absolutely. And that is the big driver behind what I do because when I got out of physical therapy school, we don't learn pelvic health in physical therapy school. So when I got out of school,
What?
I went and I pursued the education to be able to do pelvic floor work. They mentioned hysterectomy. It was one word on a slide. That was it. The second most common surgery performed on women in the United States. But because it doesn't have to do with baby making, it's just completely forgotten when the recovery can be even more nuanced, if not or as nuanced as perinatal and postpartum issues.
Right. I mean, tell me women's health doesn't matter without telling me. I
Yeah.
can't. Yeah, it's so annoying. I feel like we hear these kinds of stories every single day and you're just like,
Mhm.
wow, really? So many eye rolls. But so coming back to okay, so we've decided we're having the hysterectomy, and
Mhm.
I would love to talk about sort of this immediate recovery. So, what are the early days of post-hysterectomy like? Maybe you can walk us through like the typical hospital stay and the initial recovery at home, and what to expect in terms of pain management and mobility and things like that.
Yeah, so in the United States, typical practice now is it's an outpatient procedure. So people often go home the same day, especially if they're having the laparoscopic or robotic surgeries. People say 24 to 48 hours, usually if they're having an open horizontal or vertical incision. It's usually either a short or no hospital stay. You get home. Most people are able to move around and get around their house, but there's some pain. Um, I everyone's pain level varies quite a bit, of course. So some people have a lot of pain, some people have very little pain, but the I would say the average person is able to get around, but they do have some pain. They don't feel their best, they're groggy, they're tired, your digestion's not working. So it's not the best early on, but people get through it. Most of the people I've worked with and spoken with that have had a hysterectomy are ultimately glad that they did it because the decision doesn't come lightly, of course. So the early days are uncomfortable, but they go by in the blink of an eye. And the thing that's lacking is support. So I'm a big believer that early physical therapy, early rehabilitation support should be a huge priority early after surgery, like within a week after surgery for almost everybody. Once they're home, able to go for short walks and able to not be on narcotics, most people have reached all those milestones within a week, if not sooner. They should be getting rehabilitation support. Just like we're learning is ideal practice postpartum. The sooner people start moving postpartum, the earlier they get rehab support, the better they do from a mental and physical perspective, the lower risk of all of the different postpartum complications like hernias, prolapse, incontinence, all this stuff. The same is true about hysterectomies and other pelvic and abdominal surgeries. It's just not the standard of care yet.
Right. Yeah. And I know the fact that that is still not standard of care, it doesn't make any sense. I'm really curious about this because, yeah, like you mentioned, giving birth and hysterectomy, and there's no recommendation for any kind of pelvic physical therapy. What do you think that is? Is that just a lack of understanding, or that what we talked about earlier, women's health doesn't matter? Like what?
Yeah.
Like what is this? I don't get it. It's so weird because I feel like physical therapy is recommended for a lot of other surgeries, if not
Absolutely.
all.
Yeah. Like if you sprain your ankle, you get recommended physical therapy. Like this is a way bigger deal than that.
Yeah.
I think the system just isn't set up with prevention in mind, really for anything. So it's a reactionary system. They want to wait until we have a diagnosable code, a codable diagnosis to refer to physical therapy. I believe that if someone wants to be proactive in their recovery and they want to work on avoiding incontinence, learning how to avoid prolapse as you get older and pelvic pain and all the stuff people are afraid of around surgery. I don't think we need to wait until a woman is suffering to offer help, but that's just not the way the system is set up. across the board. And I don't think it's happening anytime soon, although we're making strides in that direction little by little.
Right. So, in other words, we have to advocate for ourselves hardcore,
Yes.
basically. Yes.
Yes. And seek good resources that match your goals and think outside the box. Telehealth is an incredible option now. There's so many ways to get help besides in-person physical therapy, which can be really hard to get into because it is so specialized.
Right. Yeah, of course. And are there any other tips for someone who is recovering from a hysterectomy in the short term, like anything specific they should avoid or focus on in addition to what you were just sharing, like in
Yeah,
the
so
first few weeks?
absolutely. The language that I usually use is like red and yellow flags. So everybody knows to watch out for red flags. Those will be in your surgeon's post-operative instructions. So bleeding, signs of infection, feeling unwell, getting a fever. Everybody knows to watch out for that kind of stuff. The yellow flags are the warnings that come before pain, the early signs that you might be doing something wrong, doing too much, stuff like that. So the most common yellow flags, there's four main ones. So one is lower back pain or discomfort, abdominal pain or swelling, especially if the swelling is getting worse through the early weeks, it should be getting better. If it's continually getting worse and you're like blowing up like a balloon at the end of your day, that can be a sign that something's going on. Pelvic pressure or heaviness. A lot of people describe this as feeling like there's a tampon in when there's not. Sometimes it's called phantom tampon in the pelvic floor space, and leakage. So urine leakage, leakage of fecal matter or gas.
Okay, so those are the things that we should be
Yeah,
looking
those
out
are the
for.
main
Yes.
four that
Okay.
people experience the most often.
Okay. All right. No, that's good to know. And I think super helpful again, like you said, because sometimes we don't maybe read all of what the surgeon says to us or what
Yeah.
they've given us. I feel like I'm guilty of that skimming. So yeah, that's super helpful. And then in terms of exercise, which I know is an area of specialty. So if you're recovering from a hysterectomy, how do you get back to exercise and movement? What advice do you have for someone who wants to resume physical activity?
Yeah. So the typical advice after hysterectomy is wait, usually 6 weeks. It's almost always 6 weeks after any surgery that happens to a woman. So it's usually wait 6 weeks and then ease back into it with no other guidance given beyond that. And things are not 100% normal at 6 weeks. That just means your incisions are mostly healed and you're not likely to encounter any life-threatening complications. It doesn't mean that you're good to go and do anything as long as it doesn't hurt. So I think continuing to look out for those yellow flags, that those four main ones, those are the things that will pop up if you're doing the wrong exercises for your body, if you're bearing down on your pelvic floor while you're exercising or bearing out against your abdomen. So like if you're still swelling up after your workouts or your back is hurting, the more active you get after surgery, if you're feeling phantom tampon after a long day out shopping, those kinds of things can be the clues that your body isn't ready for the activities that you're asking it to do. Where people get mixed up a lot is that they feel those sensations and then they just rest and then they try those activities again. A better approach is to try to investigate why those activities are creating symptoms for you. So is it that when you're trying to do that core workout you've been trying that you're bearing down on your pelvic floor, that can create swelling and create that phantom tampon feeling. It can create leaking. So investigating the offending activities and trying to kind of patch the holes and address the reasons why you're having those symptoms is a much smoother approach to getting back to exercise.
Okay. And so in terms of types of exercises that are recommended, are there types of exercises that are recommended, or is there anything that should be avoided?
The things that should be avoided are things that are creating downward pressure on the vaginal cuff, assuming someone had their cervix removed, which almost everybody does. So they remove the cervix and they close up the top of the vagina. So if you're doing something that's creating pressure down towards that incision, that can create a lot of the problems that people experience. So it's like you have to feel for that sensation of feeling that downward pressure. I always say it's not what exercises or what type of exercise, it's the how. And the only path to success for long-term pelvic floor health is understanding the how behind the way that you're moving in your chosen fitness activity. So are you a runner? There's different things that we can do with running form and gait to help to improve your long-term pelvic floor outcomes, especially for somebody that is having any of those yellow flags. It's not so much that you need to choose walking over running. It's we need to look at how you're running. And the same could be said of just about every activity you can think of. In general, the safest place to start is with slow tempo resistance training, whatever kind of resistance training that person is willing and able to do. So resistance training could be Pilates, it could be weighted resistance training, just depends on the person and their preferences. But typically, strength training for 6 to 12 weeks is a great place to start before working back in impact or like a dance fitness class or something that's more unpredictable, where you can't modulate the pressures in your body and you can't pay attention as well to what's going on because there's loud music and there's a group around you or you're trying to go fast. Those things should typically come later after you've reintroduced your strength, gotten back to your basic movement patterns and that sort of thing.
Okay. And then in terms of like anything additional for keeping your pelvic floor healthy, is there is there anything that you would recommend?
Absolutely. So, core exercises and core exercises also work your pelvic floor. So, being able to know what pelvic floor elongation and contraction should feel like when you are doing a core exercise and making sure that you're addressing the weaknesses that have come up from what you've been through. So, like in a case like mine, for example, I've had large, numerous fibroids for a very long time. That puts a lot of pressure on your core and pelvic floor. So, my surgery was 7 weeks ago today, or yesterday was 7 weeks. So I'm still working on, like I'm cleared for exercise, but I'm still working on strengthening my transverse abdominis, which is our like deep core corset stability muscle, and strengthening my pelvic floor. But those things are better strengthened with things other than just Kegels. So Kegels are like a great starting point, but then we want to do exercises where you're working on the coordination and the strength and the endurance of all of those muscle groups together, your core, your pelvic floor, because that's how they actually function in our day-to-day life. Like when you need to carry something heavy for a period of time, those muscles need to have strength and endurance beyond what you need to like lay on your back and do a Kegel. So I'm still doing exercises to help to strengthen those muscles because they've had pressure and inflammation on them for a very long time.
Right. Yeah, of course. That totally makes sense. Yeah, so many things to consider. It just makes me think about something else that you had mentioned prior to us recording, and there's a study about women who've had a hysterectomy being at risk of entering perimenopause earlier. Can you discuss
Mhm.
this risk and how it manifests? And obviously, these are for women who keep their ovaries. Can you speak about that too?
Yeah, absolutely. So I think we should clarify first that having a hysterectomy does not mean you go straight into menopause. That's still something that a lot of people think. It's a separate surgery called an oophorectomy when people have their ovaries removed, and that does send you into surgical menopause. But most people keep their ovaries for the kinds of reasons for hysterectomy that we're discussing. But some studies have found that it seems to kickstart perimenopause on average about 4 years earlier. There's also a sort of confounding variable in that women that are prone to these disorders are also likely to have worse and earlier perimenopausal symptoms. Like I had my first cycle when I was 10, and that's a big risk factor for ending up in the shoes that I'm in now. So I might have encountered earlier perimenopause no matter what I did. So there's a lot of variables and it's not well studied, but it does seem that it can affect the blood flow to the ovaries and kickstart perimenopausal symptoms to have a hysterectomy. And a lot of the symptoms that women experience after hysterectomy are written off as not being a part or because of the hysterectomy, and then they're just kind of floating with no help. I think the way that it should go is when women have hysterectomy, they should be getting automatic education about these topics and automatic resources about where to turn if they do start having perimenopausal symptoms that are affecting their quality of life or that they're not happy with, because your surgeon is not always the best person to talk to about this stuff. But if the surgeons would just give out resources of like, hey, if you have surgery and a year later, now your hair's falling out and you're experiencing brain fog and you don't feel like yourself and you're having mental health symptoms and your skin is changing, you might be in perimenopause. Here are, a list of people in our area that could help you with that. That would
Right.
change so many women's lives if they would just take that simple step.
Yeah, I mean, that is also really baffling to me. I just had a conversation with someone who did a program with me many years ago, and she reached out because she has endometriosis and is finally deciding to have a hysterectomy because it's obviously very similar to you, been a very long journey for her. And she said that the surgeon said they may have to take her ovaries depending on what's going on once they get in there. Um, and I was like, okay, so has anyone talked to you about hormone replacement therapy or anything like that? And she said, no, we haven't had that conversation. And so I'm just like, oh my goodness, this feels like a very important conversation to be having because you're about to potentially be put into surgical menopause. And that should be in conversation that you're having prior to the surgery. Anyways, so she just basically said, no, I haven't had any conversation. And I'm basically being told generally that I can't have any hormones because of the endometriosis. So we hear that a lot
Yeah.
too. So I'm curious what your thoughts are on this part of things.
Yeah, I have seen a similar situation play out a number of times. I think if someone's going straight into surgical menopause, they need to have hormone therapy on deck. Like the prescription needs to be written and it needs to be ready to be used, if not preventatively, but at the earliest onset of symptoms, because that transition into surgical menopause is one of the hardest things I've ever seen anybody go through. I've seen
Yeah,
people have just like catastrophic dives in their mental health. It's just, it can be horrendous. And the lack of support is just, it should be malpractice, in my opinion. It's
I
horrible to
agree.
leave women in the dark like that.
Yeah.
And if anyone's listening and is in a boat like that, I would highly recommend trying to find a surgeon that's up to date or a physician if your surgeon doesn't work with menopause stuff, but find a menopause specialist before having surgery because they'll be up to date on the best practices on prescribing hormone therapy. For women with endometriosis and whatnot, because it's not the case that just because someone has endo that they can't use any estrogen therapies or any hormone replacement therapies.
Yeah, I know. I feel like the science has changed, but so many doctors have just not caught up with it. So I mean, I have
Mhm.
other people in my life who are dealing with various other things, and they're also being told that they don't need hormones or they can't use hormones. So I just feel like that is a glaring gap in medical care that needs
Yeah,
to be closed up. It's
yeah,
crazy.
it's really hard. It's really scary. Yeah, you're right.
Yeah, it's really out of control. So coming back to someone who has their ovaries still, obviously you mentioned the potential for entering perimenopause earlier. What are some of the symptoms that someone should be looking out for? And when might they start to manifest? Does it depend on the person? Like someone may go into perimenopause or start going, like their ovaries stop working as well right off the bat, or does it take many months, years? What does it look like usually?
Mhm. This is purely anecdotal to my knowledge. This has not been well studied in any way, but just from the hundreds of people that I have worked with, it seems that the closer someone is to menopausal age, so if they've already started experiencing perimenopausal symptoms before having their surgery, it seems like they tend to have the more acute hormone drops. So they'll immediately feel different after surgery. I've even had some people get tested and see that their estrogen and even their testosterone has gone from something to zero after surgery for whatever reason. It seems to be more acute in that population. For women that are more my age, like mid 30s, not perimenopausal yet, it seems to be more of a slow burn where they feel great after surgery, but maybe 6 months later, now they notice their body's different. They're not responding to exercise and recovery the way that they used to. They're really sleepy all the time. They're starting to get hot flashes. They don't feel like themselves. Seems like more of a slow burn for people in those shoes. And across the board, people are just like it's like the doctor just washed their hands of these women as soon as the 6 week marks has passed and the incisions are healed and they're left in the dark with nowhere to turn and not sure how to get help when these symptoms do start to show up.
Yeah. Oh, I think that I've had many similar conversations to you with regard to this. I mean, I remember having an appendectomy like a year and a half ago, almost 2 years ago now, and it was the same thing. They were
Mhm.
thrilled, all was going well a few weeks post surgery, and that was the end. I mean, there was no conversation about any
Yeah.
kind of physical therapy, and I'm like, okay, these are tiny incisions that are happening in your abdominal muscles, but they're still incisions in your abdomen.
Hmm.
It's
Which is
it's
always a
just
big deal.
Right. I know. And the fact that literally nothing was ever said to me is just amazing. Thankfully, I know people who are physical therapists. Otherwise, yeah, I would have been in the dark like so many of these women that we talk to. So is there anything else that you want to share about advocating for help, like how women can effectively advocate for themselves, in the healthcare system as it currently stands when they're dealing with these post-hysterectomy symptoms, whether it's associated with the surgery or there is a hormonal component to it?
Yeah, I think the biggest step is just getting prepared and educating yourself on these topics, understanding the symptoms of perimenopause and hormone shifts in general, so you know where to turn if something doesn't start to feel right. And then from the pelvic floor, like physical recovery space, a lot of women just don't have the language to communicate what they're going through. So learning about your pelvic floor, which is like a quick YouTube away of like common pelvic floor function problems, um, just brush up on that. So then you have the language of what to ask for, what to say is wrong when you're trying to get a referral to physical therapy if you're choosing to go the insurance route. And then also being willing to think outside the box. I work fully digitally now because everything that I do is specialized to these pelvic surgeries. So there are options out there with no health insurance insertion, no issues navigating the medical system. You can go out there and get help or hire a coach to work with you through whatever behaviors, whatever exercise program you're trying to work through. Hire someone to help you with it. We have so many options now, even though things aren't great and there's a lot of work needing to be done. We have more options than ever. So thinking outside of the box, thinking digital, thinking telehealth, leaning into coaching instead of depending only on the health insurance medical system, I think is really a key for helping people get the outcomes that they want.
So good. I feel like everything you shared is so helpful. Do you have any final thoughts for anyone who's listening and might be navigating this at some point in the process? I know that people listening will
Yeah.
be in various stages, but do you have any last words of advice?
Yeah. I think I just like to repeat that a big green flag when you're searching for a physician to help you make these decisions is finding someone that will give you all of your options, even if it's not an option that they sell, and be willing to travel to find that person. Most insurances cover out of state care. More major metropolitan areas are places where you can find the best surgeons. They'll typically be called minimally invasive gynecological surgeons. They're the people to look for to help with these kinds of issues, especially if you have a complex, the trio, which is fibroids, endo, and adenomyosis.
Yes. Okay. Thank you so, so much. I really appreciate this knowledge. And I feel like just the fact that you have this very long experience with dealing with uterine related problems, and then you've gone through the surgery. And so recently, everything you shared was just so fresh and really interesting in terms of, like what we can do. And, from beginner all the way to an expert who's been dealing with this for a long time. I think that it was just wide ranging. So thank you so much, Jocelyn. I really, really appreciate all of this information.
Yeah, thank you so much again for having me.
Yes,
It was great.
absolutely. Can you share with everyone where they can find your work? Because I'm sure there will be a lot of people who want to work with you.
Absolutely. My Instagram is where I'm the most active. So my Instagram handle is Dr. Jocelyn Wallace. I also have some links on my Instagram, so you can go and click the link to download my free pelvic health questionnaire. That it just gives you a list of questions that gives you that language to talk to your doctor. So you can check off any symptoms you are having and bring it to them so you can talk about it, the things that you might not have even realized could be a problem.
Amazing. Thank you so, so much.
Yeah, thank you.
That's a wrap. Be sure to click that subscribe button to join me for more Girl Talk Gone Menstrual in upcoming episodes. But in the meantime, check out my latest Period Party episode. And if you're looking for a deeper dive into your hormones, go ahead and take my period quiz at nicolejardim.com/quiz.